If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, everyone. This is Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center. If you missed any of the last two shows, we've been talking about the mechanisms of how cancer becomes resistant to chemotherapy and various natural medicines that have been studied to overcome that resistance. So today we're going to finish up the discussion on all the different mechanisms of how cancer cells become resistant. But last week, if you missed it, we talked about ways that cancer cells can wall themselves off from the chemotherapy by activating the clotting system, how cancer cells can take and activate the clotting system to form a wall around themselves to prevent the chemotherapy from penetrating. So we talked about natural things that can possibly break down that wall and improve chemo delivery. And then I also talked about how cancer cells have these pumps. That's exactly what they're called. They're pumps that pump the chemotherapy out of the cancer so it doesn't get through. And we talked natural things such as theanine and selenium and something in green tea called EGCG that can help inhibit those pumps to keep the chemotherapy in the cancer cells longer and cause more of the cancer cells to die. And then we also talked about natural things that inhibit cancer from neutralizing chemotherapy. Cancer cells can add things to the chemotherapy to neutralize it so it doesn't affect the cancer cell's DNA and prevent cell death. There's natural things that inhibit that, such as the theanine and the selenium and some vitamin K3, vitamin C mixture that we talked about. But today, we're going to talk about the cancer cell's repair system. Cancer cells have these ability to repair, that even if they do get damaged by the chemotherapy, they can fix themselves and then not die. And cancer cells also have what I call a life support system and retaliation system, that even if they do get damaged by chemotherapy, they basically start these things that stop cell death, these mechanisms that shut that off, like a life support system. And then they, in essence, kind of retaliate and produce things that make them more invasive, make them more likely to form blood vessels, and suppress the immune system. So we're going to talk about that today. And then when we finish that discussion, we're going to begin talking about the immune system, how the cancer cells avoid the immune system, and natural things that can help make the immune system work better. Okay, so let's continue the discussion on chemotherapy. So chemotherapy tends to mostly affect cancer cells that are dividing. And a lot of people think that, just because cancer is growing, that all the cells are dividing. But that's not actually the case. Most of the cells in a tumor, most of the cancer cells are in a resting state. In terms of most of the solid tumors, so breast cancer, colon cancer, pancreatic cancer, something where like almost 90% of the cancer cells at any given time are in this state of resting. They call it the G0 phase. And this is important to know because most chemotherapy drugs only affect dividing cancer cells. But, the cells that are resting come out of their resting phase and go into a dividing phase in a random fashion. And that's the whole purpose why chemotherapy is not just given one treatment. Person goes in, has multiple treatments. Some chemotherapies might be even given for 5 days straight or 2 weeks straight to try to catch the cells when they come out of their resting phase, because that's when most chemotherapies are effective. But those resting cells, if they are resting when the chemotherapy is in the body, they often resist the chemotherapy and then they don't die. Then they come out of their resting phase when the chemotherapy is finished and it starts dividing. So people wondering, like, why do cancer cells grow if a lot of them are in the resting phase? Well, that's because, there are some that are still dividing, a small percentage, 5-10%, and then they don't die like they're supposed to. So it's like, babies being born and elderly people not dying. So that's how it starts to accumulate, the cancer cells. But they're not dividing any faster than a lot of our cells in our body. Like our intestinal tract can rapidly divide, but cancer cells are often not dividing as much. There are some cancers that do divide faster than others, like some leukemias, like the CML leukemia. But for the most part, the solid tumors, like over 90%, are in this resting phase. So they call this resting phase the G0 phase. And it occurs more in bigger tumors, too, because a big tumor doesn't have a very good blood supply. We talked last few lectures that the blood vessels can easily collapse in cancer cells and in tumors, and then that impairs blood flow. And what's carried in blood? Oxygen. So that the cancer cells don't often have a lot of oxygen. And when they don't have a lot of oxygen and nutrients because of lack of blood flow, the cells go into this slower, almost hibernating state. They're still preparing to divide, and they're still carrying on some basic cellular functions. Just like when we're sleeping, we're still alive, and we're digestive tract's working, heart's still pumping, but we're resting, we're not fully active. So there's still things going on, but it's not like a lot of DNA replication happening at that time. Okay, now there are some drugs that can kill these dividing cells, like the platinum drugs, cisplatin, carboplatin, oxaliplatin, and some other drugs like adriamycin. But for the most part, many types of chemotherapy drugs affect the dividing cells. And even the platinum drugs and adriamycin works better when the cells are in the dividing state. So there is research showing that patients have a better response to chemotherapy when more of the cancer cells are in a dividing state and not in this resting phase. So there was a study done in the Annals of Surgical Oncology in 2003 where they took patients that had esophageal cancer of the esophagus, and they measured, there's this thing, it's called the Ki67 Index. It's a measure of how many cells are dividing in a tumor. So they did biopsies to first conclude that the person had esophageal cancer and measured this Ki67 index and then looked at who had a response to the chemo and who didn't. The people that had the Ki67 index, which means more of the cancer cells in dividing, if that more than 50% of the cancer cells were dividing in that biopsy sample versus 20%, the patients that had less than 20%, they had double the response rate to chemotherapy. Double the response rate when the Ki67 index was higher. So chemotherapy does work better when cancer cells are dividing. We of course don't want that to happen when you're not getting chemo. So they've done studies showing that person has a better response to chemo when the more cells are dividing. But after chemo is finished, then you want that Ki67 index to be low. And there are natural things that can suppress that after chemotherapy, so it's not dividing. But during chemo, you actually want those cells to be out of the resting phase because it's the resting ones that will resist the chemotherapy and then come out of the resting phase, go into the dividing phase when you're not in chemo, and then the cancer can start to grow more again. There is another study. There's been many studies on this Ki67 index as a predictor of response to chemo. There's one in the journal Breast Cancer in 2010. It was done in Japan, where they took patients and they classified them based on the Ki67 index. And none of the patients had a response to chemotherapy if the Ki67 index was less than 25. That means that if the cancer cells weren't very dividing much at all in the tumor samples, then they didn't respond. Most of the patients that had a complete response, pathological response, when they went in and they didn't find any more cancer cells left after the chemo, the Ki67 index on average was 63%. Again, a higher Ki67 index, more dividing cancer cells, greater response to chemotherapy. Okay, so are there any treatments, natural things, or any other treatments that can take those cells out of this resting phase before chemotherapy? Well, some basic things like surgery, actually. I mentioned that the bigger the tumor is, the more likely it's going to have a lot of cells in the resting phase because the big tumors don't have a good blood supply, and then they're not getting enough nutrients and enough oxygen, and so they will tend to have more of the resting cells. So surgery, reducing the amount of cancer in the body before chemotherapy, can actually reduce the numbers of resting cells and make then the chemotherapy work better, instead of doing chemotherapy often before and then surgery. I mean, there's definitely a combination of things going on in the United States where they sometimes do chemo first, but definitely chemo after surgery is a good thing because there's going to be less of those those resting cells. Radiation also done before chemotherapy or concurrently with chemotherapy can decrease the amount of resting cells. But there is a natural thing. There's something called arginine. Arginine is an amino acid. It's a compound found in protein. So all proteins, anytime you eat a protein, whether it's from beans or meat or chicken, contains these compounds called amino acids. They're like the building blocks of protein. And there are many types of amino acids. You might have heard of one like tryptophan, for example. But there's all kinds of different types of amino acids. And there's this one amino acid called arginine. And it appears that a lot of cancer cells, a lot of solid tumors like colon cancer, breast cancer, stomach cancers, lung cancers, like this arginine. And they actually make this enzyme that takes arginine from our protein and converts it into something that helps the cancer cells go into a dividing state and make DNA and grow. So there's some researchers in the UK in 1992 at the Aberdeen University that studied giving arginine to patients with breast cancer 3 days before surgery and seeing what happened to the Ki67 index just 3 days before. So they gave 10 people 7.5 grams of this amino acid arginine 4 times a day, and then they stopped after 3 days, and then they did the surgery, and then they measured, the group that had this, the arginine, the Ki67 index, and it was much higher in the patients that had the arginine than in the group that didn't have the arginine. So they did that for 3 days, and then they said, okay, well, it increases the number of dividing cancer cells, so let's see if it's going to help make chemotherapy work better, because they were familiar with the research that says that cancer cells respond better to chemo when they are more in that dividing state. So they took 96 patients and they published a study in the International Journal of Oncology in 1998. They took, again, breast cancer patients with locally advanced breast cancer, and they put them either on chemotherapy with this arginine, and they used 30 grams a day of arginine, or just a placebo with the chemotherapy. And they gave them adriamycin, Cytoxan, and a few other drugs, standard drugs used for breast cancer, 6 cycles of it. And they gave, before each chemotherapy, they gave this arginine 3 days before. Just 3 days before, then they stopped. They didn't continue the arginine after the chemo because, like I said, that's not good because it could help make the cancer cells divide. But they gave it as a pre-treatment before each chemo, followed with chemo. Chemo kills more cancer cells that are dividing. Well, 88% of the patients in the arginine group had a good response to the chemotherapy, whereas only 52% of the patients that just had chemo alone had a response. And then when they went in the area where the breast tumor was, and they surgically removed that area, 14.5% had what's called a complete pathological response, which is the best response you want to have to chemo, where when they went in, they couldn't find any cancer cells left. They had all completely died. Not a huge amount, but 14.5% had a complete pathological response versus 6% in the group that just had chemo alone. So over double the complete pathological response. And then in terms of shrinkage, just overall shrinkage, the patients with the arginine had a better response. And it was just 3 days before. It makes a lot of people nervous thinking about taking arginine before chemotherapy. But like I said, it's those resting cells that are the ones that are the scary cells, because they come out of that resting phase after the chemo, and then they start proliferating and growing. Those are again the ones that come back. So doing a little priming before can help make that chemo work better, and then you stop those dividing cells after chemotherapy is so that they don't start to come back at a faster rate. Arginine also has a nice other benefit besides helping the chemo work better, is it helps the immune system. We have these cells in our immune system called natural killer cells, and these are the cells that are programmed to destroy cancer cells. So they actually did a study done where they gave arginine to patients with colon cancer just 3 days before, and they measured natural killer cell activity, and it increased. Some patients, it doubled the activity of the killer cells. And then when they removed the actual tumors in the colon, they found infiltrate a large amount of these killer cells in the tumors compared to the group that didn't get the arginine. So it makes possibly chemotherapy work better and also makes the immune system respond strongly to the chemo. And this is important because there are some chemotherapies that will suppress the natural killer cells. Some really common ones like that adriamycin, doxorubicin used in breast cancer, and the Cytoxan, also used in breast cancer, and 5-FU, a common drug used in colon cancer, pancreatic cancer. So these are drugs that can kill cancer, but they hurt the immune system. And later on, we're going to talk about how we don't want that to happen. Chemo, even with all these things that we've been talking about, does not kill every single cancer cell. And we want to make sure that our immune system is capable of killing the rest. And chemotherapy certainly doesn't support our immune system. And a lot of people had immune system problems even before starting the chemotherapy, because that's probably why they got the cancer in the first place. The immune system wasn't functioning well. So we don't want to make the immune system worse. Arginine, as a pre-treatment to chemotherapy, helps the immune system. Even the 3 days, the effect lasted 5 days after stopping the arginine. So if it's given on and off, it can help the immune system at the same time. Okay, so we're now using arginine to take the cancer cells out of the dividing state. But it gets a little bit more complicated than that. Once the cancer cell moves out of its dividing state, it starts to do different things. So you can think of it as an analogy as, okay, you're resting in your bedroom. So that's like this G0 resting phase. Then you get up, and then you go to the bathroom, do your thing in the bathroom. Then you come out, go to the kitchen, make some breakfast or something, go in the living room, watch the news, and then out the door you go. And that's exactly what cancer cells do. They move from room or state or phase, they call it, from one phase to the next. So there's this resting phase, which is called the G0, where the cells are mostly resting, carrying on a few cellular activities, but not doing a heck of a lot. Then they come out of that resting phase, and now they go into a room, it's called the G1 phase, where they start growing the things that they need to help replicate their DNA. Then they go into another phase, or another room, called the S phase, where they actually are replicating the DNA, making a copy of the DNA, because they're going to give that copy to another cell to replicate itself. Then there's another phase called the G2 phase, where it starts to make the machinery that it needs to pull itself in half, so it can make that second cell to give the DNA copy. So that's like moving out of the kitchen, going into the living room. And then after it makes the things that it needs to pull itself apart, then it pulls itself apart, and they call that the M phase, or mitosis. Then it pulls itself apart, so it's in a different state, and then it divides in half, and it's two cells. And the whole thing repeats. It goes back to a dormant phase, rests, and then gets ready to divide. And, cells do this on a regular basis because there's no need to make all this machinery when you don't need to divide. And it's also a protective thing. We're exposed to all kinds of toxic things in our world. And if we had our DNA unwound, exposed easily for damage, then we could get even more cancers. So our DNA is tightly wound up like a ball of yarn, and it's protected from all these harmful things in our environment and stuff. And it only unwraps itself when it's getting ready to divide. And it goes into these different phases, and then it goes right back to that resting phase. Okay, so we're going to take a little break right now. When we get back, we're going to talk about natural things that can help make chemo work better by locking them in one of these phases.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, we were talking about how chemotherapy, for the most part, works best when the cancer cells are in a dividing state. Cancer cells in a tumor are in a dividing state. But not a lot of the cancer cells in a tumor are in the dividing state when the chemotherapy goes into the system. We talked about that a lot of the solid tumors, like breast cancer and colon cancer, pancreatic cancer, maybe over 90% of the cells at any given time in a tumor are in a resting phase. There are some chemotherapies that can kill some of those cells, but most of the chemotherapies work better when the cells are out of that resting phase. So we talked about there's an amino acid called arginine that has been studied in a human study in breast cancer that did improve the effects of chemotherapy in women with breast cancer by taking them out of that resting phase right before the chemo and then inducing cancer cell death. But it gets a little more complicated than that, is once the cancer cells come out of a resting phase, they enter these different phases. And some of the phases are to replicating the DNA and then actually dividing the cancer cells in half. Well, they have found that different chemotherapies affect different phases more. For example, the drugs like cisplatin and drugs like carboplatin and adriamycin, doxorubicin affect cells that are in what's called the G1 phase the best. That's the phase when the cancer cells are starting to make the things that they need to replicate the DNA. And so if the cancer cells happen to be in that phase, when the platinum drug or the adriamycin goes in the person's system, it will kill more of the cancer if they're in that phase. So I'm going to talk about there's natural things that can lock them in that phase if the person happens to be going on a platinum drug or an alkylating agent that can help make that work better. There's another group of drugs called the anti-metabolites, like a drug called gemcitabine, used for pancreatic cancer nowadays, and another drug called 5-FU, used for a variety of cancers like colon cancer and pancreatic cancer, that works best when the cancer cells are in what's called the S phase, which is the DNA replication phase, because those drugs look like components of the DNA, and the cancer cell uptakes them to start to replicate their DNA and realizes, oops, that's not DNA, and then dies. But if the cancer cell's not replicating the DNA, then those chemotherapy drugs won't affect them as much. So, if you don't mind this analogy, I talked about, going from the bedroom to the bathroom to the living room to the kitchen and stuff like that. Well, what happens if somebody, threw a bomb into the bathroom and you're not in there? Well, you're not going to get affected. So if the cancer cells are not in that phase and the chemotherapy only really targets that phase the best, then they can escape. They escape it, or they move out of it. And so there's ways to lock the door, close the door on them, then bring the chemotherapy in, and then more will die. There's also another set of drugs called the vinca alkaloids, vincristine, which is used in leukemias, and navalbine, which can be used for lung and breast cancer. And then the taxane drugs, which include Taxol and Taxotere, which are being used from breast cancer and hormone-resistant prostate cancer, that work best when the cancer cells are in what's called the M phase, where they're starting to pull themselves apart. That these drugs affect the compounds that help pull the cells apart. And if those cells, again, aren't in that process, then they can be resistant more. So what natural compounds have been studied to lock the cancer cells in some of these phases? Well, one of them is a bioflavonoid called quercetin or quercetin. I've heard it pronounced different ways. It's spelled, though, Quercetin. This is a natural compound. It's called a bioflavonoid. It's found in high amounts in onions and in apples, but it's found in lots of plants too. And it has been shown to lock cancer cells in what's called the G1S phase, right in between those two. And I mentioned that the drugs like platinum drugs, like cisplatin and carboplatin, and drugs like doxorubicin or adriamycin work best when the cancer cells are locked in that phase. So in this study, there's a study done in Austria at the University of Innsbruck where they gave quercetin to animals 24 hours before they gave chemotherapy, and they used the cisplatin drug. And again, cisplatin works best when cancer cells are in this G1 phase. So they gave them lung cancer, and this was published in 1990 in the International Journal of Oncology. They gave mice lung cancer, and then they gave a pretreatment of quercetin for just 24 hours, and then they started cisplatin, and they gave cisplatin for 13 days, and they gave them in 3 different dosages along that time. And then actually the cancer didn't respond very well at all to the cisplatin. By the end of the study period, the cancer was 1.5 times bigger than when it started. But in the quercetin group, the cancer didn't grow. So it didn't make it work better, but the cancer didn't grow anymore. It stayed stable when it was combined with the cisplatin, where the cisplatin alone in this study didn't work, and it actually grew. And quercetin, what's nice about it, it was actually shown to reduce the toxicity of cisplatin in the kidneys. That's a common side effect of cisplatin, and that's why they moved to carboplatin, another derivative, a lot, because cisplatin can cause kidney toxicity. Well, here's this natural agent in animal studies that made the cisplatin work better, but also reduced the toxicity on the kidneys. So a lot more studies need to be done, but that's some exciting stuff. But there's more studies. There's more animal studies done on quercetin. There's one done in China and published in the Journal of International Immunopharmacology in 2010. And this one was studied with doxorubicin, another chemo drug that has been shown to work best when the cancer cells are in the G1 state. So they took mice and they implanted them with breast cancer. And they started the treatment when the tumors were 1 centimeter. And then they gave dosages of doxorubicin on day 1, day 8, and day 15. And then that just by itself. And then they gave the adriamycin with quercetin. And they gave a pre-treatment of quercetin. It really has to be given at least 24 hours beforehand, they found, to start to work and lock the cancer cells in this G1 phase. Well, then, so they did that. They gave 3 doses of chemo, killed the animals on day 43. And in this group, the adriamycin, again, it didn't shrink the cancer cells. It slowed them down so that they didn't grow as much as the control group after 4 weeks, but they still grew and slowed it down. But the group given the quercetin with the adriamycin, the cancer shrunk by over 50% at the end of the 4 weeks. So it actually shrunk, reduced by half, whereas the group with the adriamycin, it continued to grow, but at a slower rate than the control. And it's the same time it was shown to help the immune system work better. We're going to talk at the end of this discussion here that there's these cells called T1 cells, and they are cells that help fight and respond to cancer. Well, this quercetin made this doxorubicin work better, and at the same time improved the T cells' response to the cancer. So more research needs to be done on quercetin. Real cheap. It's well tolerated. It's commonly used for allergies and asthma, arthritis. It has some anti-inflammatory effects. It's very well tolerated stuff and cheap. And these animal studies are very encouraging. There has been some human studies done. I've seen some case reports of using quercetin intravenously for women with ovarian cancer, showing that it helped lower their CA-125, a tumor marker. But not a lot of human studies on quercetin in cancer. There has been another study done in China where they gave mice with breast cancer, again, doxorubicin with or without quercetin, and after 4 weeks, it was half the size. So another study done, cancer, chemotherapy, and pharmacology in 2010 in China. So it's been studied a lot. Right now, they've been experimenting with different types of quercetin. Quercetin supposedly is not very well absorbed. So when you eat an apple or onions, you're getting some, but not a lot. So there are companies that are taking quercetin and using different derivatives of it, and that might improve the availability of it and the absorption of it. And there's one called alpha glycosyl isoquercitrin that is 18 times more available and absorbable than regular quercetin. That might be the one to do more research on. Maybe the higher dose of the quercetin might work better. So quercetin locks cancer cells in this G1 phase, and cisplatin, carboplatin, oxaliplatin, and doxorubicin work best when cells are in that. But if a patient's going on a different type of drug, like a drug that affects cancer cells in the S phase, then you wouldn't want to use the quercetin. There is drugs like gemcitabine, which is being used for pancreatic cancer and bladder cancer, and drugs like 5-FU, which are being used for colon cancer and pancreatic cancer, that work best when the cancer cells are in what's called the S phase. The S phase is the phase where cancer cells are dividing, or replicating, should I say, their DNA. And these drugs, the 5-FU and gemcitabine, look like components of DNA, and so they help inhibit the replication of the DNA. But if the cancer cells aren't in that state, that room, that phase, then they'll be resistant. So there's a natural compound called resveratrol, which has been shown, if it's given as a pretreatment about 24 hours before chemotherapy, that they find more of the cancer cells are locked in the S phase. The S phase, so they might be more sensitive to gemcitabine and 5-FU, and certainly they have studied that. So there's been a study done where they just first gave resveratrol to these animals, checked the tumors after, just a 24-hour treatment, and the S phase increased from 59% to 73% with just this one 24-hour exposure of resveratrol. So in Texas, they actually, a United States study, which is very uncommon, in the journal Lab Investigation 2010, they gave 5-FU to these animals that had this type of liver cancer called cholangiocarcinoma. It's a cancer that affects the bile ducts of the liver. Very aggressive type of cancer. Well, they gave them 5-FU and with this resveratrol or just 5-FU alone. And then after just a month, they saw to see how it worked. Well, the mice that were given the resveratrol, the size of the tumors were 2/3 the size of the just the chemo alone, 2/3 the size. And that made that work better. And then it's been studied for that Gemzar drug, that gemcitabine drug that's being used for pancreatic cancer and bladder cancer. And again, they gave resveratrol just as a 24-hour pre-treatment. Then they gave Gemzar. After 5 weeks of treatment, they measured the tumors, and they were 2/3 the size in the group given the resveratrol plus the Gemzar versus Gemzar alone. And that was published in the International Journal of Cancer, International Journal of Cancer, 2009. This is really important because most of us know that pancreatic cancer is a very resistant cancer. It doesn't typically respond very well to most chemotherapies and has a very short survival time. The typical response rate for Gemzar alone in pancreatic cancer is 23%. And only 23% have some response. Either it doesn't grow for a little while or it shrinks it a little bit. But then the median survival is 5.6 months. So they're not using Gemzar very commonly by itself now for pancreatic cancer. They're starting to add other drugs to it. But some people, if they're older and not doing well, it's hard for them to tolerate those other drugs. Here's a simple treatment, resveratrol, that might make Gemzar work better. That needs to be studied more. They do have different resveratrols out now. That's another one like the quercetin that's not well absorbed. So they're experimenting with adding things to it to make it more absorbable, and it might work better. So there's a type of resveratrol called Vezizorb resveratrol that might be more absorbable, and they combined it with something from coconut oil called medium chain triglycerides. It's something found in coconut oil that helps the resveratrol possibly get absorbed better. But resveratrol has been studied mostly for drugs that help in the S phase, the 5-FU, the gemcitabine, but it's not to be used with drugs that don't work very good in the S phase, like Taxol. Taxol plus resveratrol interferes and makes it doesn't work as well because Taxol doesn't target the cancer cells that are in the S phase. It likes cancer cells that are more in what's called the M phase, the phase where it's starting to divide in half. So there are research studies that say resveratrol interferes with that drug. So it is true that the natural things can interfere with chemotherapy. It's not meant for everything, but if you understand the research more of how these things work, a lot of these things can be figured out, and so they won't interfere and more likely make it work better. But resveratrol is not to be used with Taxol. What has been studied with Taxol that might make it work better? Well, another thing called milk thistle. Milk thistle, it's a plant that most people know is good for the liver. It's been studied for like hepatitis, viral hepatitis, hepatitis B, hepatitis C, and various like alcoholic hepatitis where patients have some kind of liver damage. Well, milk thistle is a plant that helps the liver repair itself better. But they have found that it has anti-cancer properties directly by itself, and it also might make chemotherapy work better. And the way it works is that it blocks the cells in this M phase. It locks them in this M phase, where that's where they're most sensitive to some types of chemotherapies, like the taxane drugs, Taxol. and vincristine, vinblastine, or navalbine drugs, and taxotere. Those are very common drugs being used. So there's been a study done in China where they used Taxol plus the milk thistle, this compound in milk thistle called silibinin, and they used ovarian cancer cells that were completely resistant to Taxol, and they added this silibinin, and it restored the sensitivity of the Taxol, which is really, huge, because ovarian cancer, Taxol combined with carboplatin works, quite good initially against ovarian cancer. It has a 75% response rate, which is a really high for a chemotherapy combination. And it can last for 6 months on average. And then often when that wears off, doctors often give Taxol every week, and then that can also work for a period of time. But then when Taxol stops working in patients with ovarian cancer, a lot of the other drugs like Doxil don't have a very good response rate. So anything that might make that Taxol work better and for a longer period of time needs to be further studied. And this silibinin, which is from milk thistle, has shown to be doing that in animal studies and test tube studies. It also doesn't interfere with cisplatin or carboplatin, the common drug paired with Taxol for ovarian cancer and uterine cancer and even lung cancer, that when it was given with cisplatin in an animal study, the tumors were 3/4 of the size when it was combined with the milk thistle and the cisplatin, and then just cisplatin alone, 3/4 of the size. So it doesn't appear to interfere. So it would be a really good natural compound to study with the combination of carboplatin and Taxol in people with ovarian cancer or uterine cancer. Uterine cancer, the typical response to carbo and Taxol is not as high as ovarian cancer. It's 43%, and the response is a little bit less, around 5 months. So it's something that needs improvement. And again, just like resveratrol and quercetin, there are different forms of milk thistle that might help work better, that are more absorbable. And there's one that's been studied a lot for hepatitis, viral hepatitis and alcoholic hepatitis. It's called Silifos, where they're combining something from soy called lecithin. There's this substance in soy. It's also found in egg yolks called lecithin with this silibinin from milk thistle. And it achieved a 75 times higher blood level than the silibinin alone, 75 times higher. So that's the one that needs to be studied. There is a study I'm aware of in men with prostate cancer using that form just by itself. But that has not been studied that much with chemotherapy. But that would probably be the one that should be investigated more. Okay, so we're going to take another break, and when we get back from the break, we're going to talk about curcumin and natural compounds that help chemo-induce cancer cell death. I'm your host, Dr. James Belanger, and this is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hi, everyone. This is Dr. James Belanger from Cancer Concepts and Compliments. Before the break, we were talking about this phase called the M phase. It's a phase where cancer cells are just about ready to they're pulling themselves apart to divide in half. And there are some chemotherapy drugs like Taxol and taxotere that work best when cancer cells are in this phase. But not a lot of cancer cells are in this phase when the Taxol is given, and that's one mechanism of how they get around it. And so they've tried doing things like giving Taxol more frequently, every week, and that can often work better than giving it every 3 weeks. But the problem with that is the bone marrow can't handle that very well, and a person starts getting anemic, and their white cell count drops, and they have to take breaks and stuff like that. But so that's the goal, is to try to give more frequent chemo to catch the cancer cells when they are in this state of getting ready to divide. But there might be some better ways to do that, where then you have to subject the person to frequent doses of Taxol, is to lock them in that state so they can't really get out of that state, close the door on them, then give the chemotherapy. And this compound found in milk thistle is looking very promising. That actually can restore the sensitivity of cancer cells to Taxol and also make cisplatin work better at the same time. Well, there's another compound that's been studied in the same mechanism, and it's called curcumin. Curcumin is a compound found in the Indian spice turmeric. That orange spice, it's a root. It looks like ginger root, but it's orange. Commonly used in Indian cooking and curries. It's not cumin. It's called curcumin, and it's found in turmeric. Well, about 20% of the content of turmeric is this thing called curcumin, and studies have found that seems to be the most active compound in turmeric. So they've isolated it from this turmeric plant, concentrated it, and most of the studies are done on this compound, curcumin, and that's what's available at most health food stores is this isolated curcumin stuff. Well, curcumin also locks these cancer cells in this M phase, and they've studied it with another drug that works best in the M phase called navalbine or vinorelbine. Navalbine is sometimes used in resistant types of breast cancers and lung cancer. And in the study, Anti-Cancer Research 1999, they gave curcumin with vinorelbine, and it doubled the ability of the vinorelbine to cause cell death in this squamous cell lung cancer. So curcumin's another one of those that's not well absorbed, and they're adding things to make it work better. And there's numerous types of curcumin on the market. I've tried a lot of them. I can't tell which one works better than the other. That needs to be studied more. But there's one called BCM95 where they take curcumin and then they add other things found in turmeric called essential oils back into this concentrated curcumin. And it makes it absorbed at least more than twice than the normal level. And then it allows it to stay in the system for a longer period of time. And so they call this BCM95, and that one would be a very useful one to study more than just plain old curcumin. Okay, so next thing is another thing that cancer cells do to help become resistant is they repair themselves. They fix themselves. So even if they did get damaged by the chemotherapy and you did things to prevent them from getting pumped out, the cancer cell can fix itself. Just like we had talked in the first show about the water coming into the basement and eventually the water does damage the furnace, well, you just fix it and then no harm done. Well, that's what cancer cells do. They can fix themselves. And there are drugs like adriamycin and carboplatin and oxaliplatin and etoposide that create damage to the DNA of the cancer cell, and that's the mechanism of how they kill the cancer. Well, there's been studies showing that if the cancer cell just takes some time and slows itself down before it divides in half and fixes the problem, then it enters the cell cycle and starts to divide in half like that. Well, there's been a lot of people like this. There's been a study done on caffeine with chemotherapy. Caffeine might interfere with the repair process, allowing the cancer cells to die so they can't fix themselves. So how does it work? Well, we all know caffeine speeds us up. Well, cancer cells, in order to fix the damage after being induced by chemotherapy, they slow themselves down. They slow down their cell division process so they have time to repair the problem. And then once it's all repaired, they divide in half and they're good to go. Well, caffeine doesn't allow them to do it. It speeds things up too much, and they haven't fixed the problem, and then they end up dying. So there's been research done both in animals and human studies on caffeine. There's this Dr. Sadzuka. He's the doctor that did the research on green tea and theanine. He also studied caffeine. This is done in Japan, published in the Clinical Cancer Research Journal, 1998. They gave a type of cancer that affects the abdomen, ascites carcinoma, to mice, and they gave adriamycin, which induces damage to the DNA. And they gave adriamycin by itself, and they gave caffeine after each treatment in another group, an equivalent to over 900 milligrams of caffeine given the day after adriamycin was given. And then after 3 treatments and 18 days of therapy, the adriamycin reduced the tumor weight to 75%. But when caffeine was added, it reduced it to 50% of the control level. So it made it work better, from 75 down to 50% of the control group. And so that's the animal study that was done. They used a pretty large dose, but a typical 16-ounce cup of coffee is 270 milligrams of caffeine, and they used a total of over 900 over the course of the day. So there's been actually some human studies done in China. They're studying it with a type of tumor called sarcoma, soft tissue sarcomas and osteosarcomas. They're a type of cancer that affects the bones and the connective tissue, like the muscles and stuff of the body. And they've given basically adriamycin, which is a drug commonly used for those types of cancers, and cisplatin with intravenous caffeine. And they've done all these, human studies on it. Not a control group, unfortunately, in many of these studies, but, when it's compared to typical response rates, that it might have a better response. Typical response rates to cisplatin and adriamycin for osteosarcoma ranges between, 40% or maybe a little more. They got greater than 80% response rates with the caffeine plus the chemotherapy, and it might have improved survival times too. So something that's very cheap, and a lot of people tolerate it. I mean, it's not for everybody. Certainly, some people that are sensitive to caffeine, this wouldn't work out. But people that have, it might be equivalent to 4 cups of coffee after chemotherapy is given. If somebody can do that's a simple, cheap treatment that might not have to be intravenous caffeine. But that's what they did in this study was they give it for at least 24 hours after, because that's when the repair process is going to take place, is after chemotherapy is given. And so it's not like the caffeine has to be given all the time. Just maybe the day after or right after chemotherapy is given for a day or so and then stopped. So the person's not on that much caffeine for all the time. So that's repair process. And then the last part is what I call the retaliation and life support system. So once a cancer cell does get damaged by the chemotherapy, it should die. But what cancer cells do is they activate an anti-cell death process, so they do not die. So you can call it like a life support system. And then they actually activate things that could make them even more aggressive. So sometimes chemotherapy doesn't necessarily shrink the cancer. It sometimes turns the cancer into a more aggressive type because of this. It's a hard thing to predict, but it's something that definitely needs to be shut down so that doesn't happen. But sometimes once the cancer cells are exposed to chemo, they upregulate these different genes that make them induce blood vessel growth, make them become more invasive, and spread places. And they know how that works, and there are natural compounds that can stop those systems from happening. So there's this main system, they call it the NF-kappa B pathway. Basically, there's this compound sitting in the cytoplasm of a cancer cell called I-kappa B. That is its inactive compound, just this protein hanging out outside of the nucleus of the cancer cell. Well, as soon as the cancer cell gets damaged by chemotherapy, this I-kappa B gets activated, and this NF-kappa B forms and migrates into the nucleus of the cancer cell. And it then attaches to the DNA, and the DNA starts to manufacture things that are going to help prevent the cancer cell from dying. And it's going to manufacture things that help make blood vessels and manufacture things that help it spread and metastasize places, and even manufacture things that are going to help increase its proliferation rate. And that's certainly not a good thing after the chemotherapy is finished. So there's all these different genes that are affected by this NF-kappa B. And so there are natural compounds that have been shown to possibly shut down this. Resveratrol, that same compound found in grapes, red wine, stuff that I talked about with 5-FU, has been shown to prevent the activation of this system. And it's been studied with this drug that's used for brain tumors called Timidar. It's used for glioblastoma and other brain tumors, really aggressive brain tumor, where they found that when the cancer cells, the group was combined with resveratrol plus this Timidar, that the survival periods were longer, and the cancer shrunk more when resveratrol was combined. And the mechanism of action, it prevented this anti-cell death pathway from being activated by Timidar. Curcumin, that same compound found in turmeric, has also been shown to do this, and it's been studied in numerous types of cancer, all done at the MD Anderson. And MD Anderson in Texas has done a lot of studies on curcumin and chemotherapy. And they've combined it with chemotherapies like Xeloda, which is being used for colon cancer, Gemzar for pancreatic cancer, Adriamycin being used. They studied it in ovarian cancer. All same conclusion. It made the chemotherapy work better by helping to prevent this NF-kappa B thing from being activated. And if that doesn't get activated, then the cancer cells can't retaliate and stop the cell death pathways, and then they undergo cell death. Another compound that's been studied, too, is Genestein. Genestein is from soybean, and soybean contains this compound that also inhibits this NF-kappa B. And they've studied that in combination with curcumin, finding that the two together might work even better. And it's been shown this Genestein to make drugs like Gemzar work better, and Adriamycin and Cytoxin. So this is a huge area of research that needs to be more studied, but lots of encouraging published studies that have been done on this. And then lastly, there's a compound in vitamin E found in rice bran called tocotrienol that has also been studied in Australia and at the MD Anderson Clinic, combining with Xeloda and Gemzar to make them work better. Also might affect this NF-kappa B pathway. So some really encouraging things to check out. Well, I hope you enjoyed the show. I'm sorry I didn't get to the immune system part, but we'll definitely start off next week's show talking about the immune system and all the ways cancer gets around the immune system and how natural things can stop that. I'm your host, Dr. James Belanger, and this is Cancer Concepts and Compliments.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.